Hello, I'm Dr. Leong, a consultant chest physician. This is an extract of a video recording from a virtual workshop titled The Management of Cough and Excessive Phlegm. This video will briefly explain the active cycle of breathing technique, also known in short ACBT, comprising of breathing control, thoracic expansion exercises, and the forced expiration technique. Thank you. Active cycle of breathing technique. So I think all of us can practice this right now. I think since we are all gathered here today, we can practice a little bit of this. Breathing control, all right? 3 parts in active cycle of breathing technique. First part is breathing control. Then thoracic expansion exercises and forced expiratory technique. So what is breathing control? All right, breathing control is gentle breathing, like you and I breathing now. All right, you and I breathing now, but we wish to use the diaphragm more. So is diaphragmatic breathing. How many of us know what is diaphragmatic breathing? Yeah, you know the Chinese Qigong, the Chinese Qigong is actually diaphragmatic breathing. Hopefully when you practice long enough, you have this power, with you. So the Qigong is actually diaphragmatic breathing. So it allows rest. All right. What happens is that diaphragmatic breathing is very important because when you use the diaphragm, it ventilates the lower part of the lungs. And you will find that bronchitis very commonly occurs at the lower parts of the lung, the lower lobes. That's why ventilation of the diaphragm, ventilation of the lower parts of the lungs are very important. So when the diaphragm contracts, what happens? Your belly should come out. All right, so you try breathing in now. All right, you try breathing in now. Put your hand over your belly. Put your hand over your belly. You take a deep breath. Your belly should move outwards. Can you feel that? Can you feel that? Okay, maybe I just show you how it's done. Okay, so I got this camera with me. So if you were to put your hand over your belly, all right? Can we all try? Put your hand over your belly. So when you breathe, you should breathe. When you breathe in, it should come out. All right? Maybe I'll just show you. See that? I breathe in. I take a deep breath. What happens is that the diaphragm here contracts. When it contracts, it is flattened. All right. When it's flattened, what happens is that it will push your abdominal content outwards. Follow? You know what I mean? So you take a deep breath. You take a deep breath. The diaphragm contracts. It flattens out and pushes the belly content outwards. That's why your hand is lifted upwards and outwards. All right. So when you breathe out, we'll go in again. All right, breathe in again. See that? Okay, so that is diaphragmatic breathing. All right, as mentioned, when you breathe in, the diaphragm contracts, pulls the lungs longer and expand the volume. That's why this part of the lower parts of the lung gets ventilated. All right. So diaphragmatic breathing is very important. Okay, shall we go forward? Yep. Now, thoracic expansion exercises. Now, what happens during these exercises? Now, this is your airway, all right? Very small airway. Respiratory bronchioles, very small airways in the region of the respiratory bronchioles. And then you find that there will be air coming in. And if this area is blocked, this channel is blocked, how is air coming in going to push out or dislodge this foreign body? Okay, now, so what happens is that the air comes in here through the pore of Kohn, channels of Lambert, and channel of Martin, and this thick phlegm or sputum will be expelled this way. So it's very important to do these thoracic expansion exercises. Okay, maybe I just show you, all right, I'll show you with this, how it's done. Okay, now, you want to breathe against resistance, all right? Let's say this part of my lung is abnormal, all right? What happens is that I put my hand over this area and I try to breathe against pressure from my hand. You find that you can actually ventilate certain areas of your lung, like here I'm pressing against it and I'm trying to take deep breaths. You see that? All right. It's sort of like squeezing. When you do that, pressure applied, and you breathe deeply in, it's sort of like squeezing the air across these channels to dislodge all this phlegm or sputum. All right, that's what you're doing. All right, so active inspiration followed by relaxed expiration with application of pressure to the disease area. All right, that is thoracic expansion exercise. All right. Okay. All right, now we can have this forced expiration technique. Okay, now I have a piece of tissue here with me. You can see this. Now, forced expiratory technique, also known as the huff, will move the phlegm from the lower parts of the airways up the upper to the higher parts of the airways, or to the upper airways. All right. So what happens is that you do this huffing. All right. You take a deep breath to mid volume, not full breath, a breath to mid volume only, and then you blow out in the form of a huff to low volume. So I just show you. All right. Mid volume breath. Or you can even say the word huff, all right? Take a deep breath. So you move this tissue, all right? You can try it by yourself, all right? And this is very important because you don't want to cough when the phlegm has not reached the upper airways, high up to the throat level. Because if you were to cough when the phlegm is actually lower down in the airways, you will be exhausted, and there will be a lot of damage to your airways. Your voice may even change, become hoarse, and your throat may be sore then. All right. So it's very important to do the huff to bring phlegm from the lower parts of the airways to the upper parts of the airways. All right. Huffing is very important. So even when we are having a cough or maybe a flu or maybe a common cold, you can use this technique to bring up the phlegm. All right. So then you practice control cough. All right. What is control cough? Control cough is actually a gentle cough with open glottis. So it should sound like this. You know what I mean? So you don't get this sound of a hacking cough. You try not to have a hacking cough. You have a gentle cough with that kind of sound. All right. Open your glottis. Can you try and practice and see how it goes? All right. So that's how it goes. This is a glottis. All right. Open glottis. Okay.